mammogram on us because of the radiation. It's created another sort of barrier. I was just wondering. And they kept on telling us that if you have to do mammogram, you have to have a shield over the thyroid because of radiation. And this is, I've done mammogram. I'm over 64. I've done mammogram severally before, and nobody had actually used any shield. And I'm getting to know this not too long ago. And apart from that, and they kept on saying that the radiation, when the breast is placed on the plates, how tightly it's that it affects even some of the glands. So I begin to wonder, I don't know. I just want to ask, is it true? Is there any scientific backing for such claim? It's all over the net. It's been going around for a while now. And then secondly, you talked about fats. I remember there was a time I was pre-diabetic. In fact, it was outside the shore of Nigeria that I was diagnosed. And I decided to study. And I know with ketogenic diets, I could go back, reverse diabetes. And I ate more of proteinous meals with healthy fats, use olive oil and the likes. And with keto diets, you are allowed to even eat pork meat. So when you talked about fats, I began to wonder because many a times I tell people to eat more of proteinous food and healthy fats than having, especially those that are pre-diabetic. If I see anybody that has been my advocate since my own experience. Because when I did that therapy and I went back to the hospital in the US and they told me that, madam, whatsoever you did, continue with it. It really helped you. And my blood sugar has been stable ever since. So now that you are talking about the fat again, I began to wonder, how do we do now? Where do we stay? Thank you.
Thank you very much. I think the key point is moderation for everything. All right. So, in obesity, we have storage of fats in our body. On the long run, the breakdown of those fats and all that comes around with obesity. It is a risk of endometrial cancer, risk of all sorts of things down there. All right. So, coming down to that, there's been a whole lot of work ongoing that's been ongoing. More researches are coming up, and there is nowhere you will go that they will tell you obesity is not good. They will tell you. So, what do we store in our body when we are obese? It's fat. So, it is practical. Everything has to be in moderation. Maintain a healthy lifestyle. I'm sure when you lost weight and all that, your sugar went back to normal and everything. So if we continue to maintain that healthy weight, you won't even have to take ketogenic diet or whatever it is. So it's back and forth. I pray God will help us. Then coming back to the mammal, the ideal thing, even if it's menstrual, shield everywhere. It's just a misnomer that I've been in the practice for so long. It's only God that can help us. But you must know the right thing. I'm glad you're well informed now. If you get to any center and they're going to do any investigation without showing the vital area, please tell them, kindly shield for me. People are getting more aware now. The awareness is there. But peradventure, and we are training and retraining healthcare workers to do the right thing. But peradventure, you get to any place, and that isn't done. Please insist they do it. We mentioned that exposure to X-ray for a long period of time is a risk. Definitely it is and it will always be a risk. But that leads to exposure, which is why you're not supposed to be doing mammo every month or every 3 months or frequently 6 months. It's a small exposure which is supposed to be okay. A controlled small exposure is supposed to be okay. And that's why we say people that are under 40, it's just ultrasound scan that they should do. And thank God for newer research, new world now, you can leave mammo and do MRI. It's even more specific. It may be a little more expensive, but you will get a better report and less exposure to radiation. Thank you, ma'am.
Thank you very much.
Thank you, Ma, for the insight we have gotten into this cancer. The question I want to ask is, now, when you talk about treatment,
Yes, ma'am.
you are an oncologist,
Yes, ma'am.
and that is the scientific process. But there's much talk about alternative therapy. And the question I want to ask now is, what is the place of alternative therapy in cancer management? I go for that. I don't know whether it's right or wrong. I read on the social media that Prince Charles was diagnosed of cancer, and he said, no chemo for me. He was going through alternative therapy. That's what I read. I don't know whether it is correct or not. So my question is, what is the place, or has alternative therapy a place in the management of cancer?
Thank you for that brilliant, commonly asked question, ma'am. On Monday, I'm going to start treatment for a patient that needed treatment. Starting at chemo on Monday. She's been diagnosed 2 years ago. She refused treatment, so we're going the alternative route, taking Sasol, taking all sorts of herbs and all that. But unfortunately, what started as a peanut size is now in the entire quadrant of the breast, the entire breast. Is in the axilla. I'm talking practically now. Is in the axilla. So the first time your sister brought that to me, I said, I'm not doing anything. I examined it. I'm like, but why did you? She said, she wanted alternatives. I said, no problem. Let's do a staging investigation. So I sent her for CT chest, abdomen, and pelvis. I checked her tumor marker. What should have been less than 31? Hers was almost 200. So my fear was, the moment I saw, my fear was, oh God, please don't let this cancer metastasize. God has really been very merciful. She's a soul mother. God has really been very merciful and kind to her. The disease was just limited to that huge lesion on the breast and the axilla. So I said, Madam, how many years do you have? 2. Or you have 4 years? 2. What do you use the ears for? For listening? I said, Madam, listen to me now. We are not walking or crawling with this information we have. We are flying. We are not jumping, we are flying. We are starting your treatment ASAP. Then when the person for the immunohistochemistry was now triple negative, that is aggressive. I said the fact that you don't even have spread to the lungs, liver, or bone, it's by God's grace. God really loves you. She was saying, oh, I may not have it. I said, Madam, this is the way to go. How many kids do you have? She told me the number of kids he has. Please be there for your children. And that was the magic word. She's starting treatment tomorrow. No, on Monday. So those alternative therapies. It's very unfortunate that things have to be like this. In terms of prostate cancers, in terms of there are different, like I said, multimodalities. Cancer generally, they have multimodalities. We have the likes of targeted therapies, we have immunotherapies, we have endocrine, androgen deprivation therapy. For Prince Charles, it may be it is a process. I'm sure it's not androgen deprivation therapy, it is still part of the standard of care. It's probably taking anti-testosterone with the likes of Casodex, bicalutamide, flutamide, or Zoladex that are suppressing the testosterone hormone. Some people may say it's alternative. That's not chemotherapy. Some patients may be taking immunotherapy, but it is different from alternative therapy like T. So when you go to the hospital, doctor will tailor your care according to your needs. Like this is my patient, I'm starting chemotherapy for Monday. She doesn't have a choice at this junction. It's chemo. It's number one. So you present early detection, presentation to the appropriate authority that can do the needful, and then give you the treatment options. There are some cancers that are early. Oh, the first thing we can do, if the tumor is small, oh, go for surgery first. Then after the surgery, we'll give chemotherapy. So, like I said, treatment is individualized. It is how you present, it is what your disease, the tumor biology is like that we treat. It's not one treatment. I remember there was one funny situation. I was consulting and some patients waiting at my waiting area. Somebody was telling one patient that doctor gave me this amoxicillin. It's what I've been using for me. Oh, it's been working very well. Hormone receptor blocker. And the patient was saying that she should go and buy it. It's a triple negative. She doesn't have any receptor to block. And so when she came, she said, Doctor, I had one patient there. The patient said she's been giving her hormone receptor blocker. I said, what, madam? What is the reason? I now opened. I said, see, the reason why I didn't give you is because you don't have any receptor to block. And that is why we're giving close follow up. I give you appointment to come, we'll check. The moment I notice anything, you've received maximum treatment for what you have. If I notice anything for triple negative, I go again on another route. So treatment is individualized. You need to know what we're doing. And please spread the gospel. Any other question?
Okay. Thank you. Okay. My question is, what does it mean to continue lactating even after the child is off breast milk, even after 5 years of breastfeeding? Yeah, because my cousin has complained of this, and to me, I said I don't understand. Probably you go to the hospital. She was like, it's just milk coming out of the breast. There's nothing to it. Until now, it's still happening even after 9 years. Thank you.
All right. The hormone responsible for lactation is prolactin in the body. The prolactin level may be high. It may be sinister or not sinister. For that patient, she needs to go and do an appropriate check of that breast. So she needs to see the OBGYN, see our doctors. They'll do their hormone profile. Whatever is high, with that drugs that they can use to control, do breast investigations, examinations, and if there's nothing happening on the breast, no evidence of cancer, I think the prolactin hormone, anti-prolactin hormone medication should be ideal for her. All right. Thank you.
Okay, good morning, all. Good morning, Ma. Thanks for the awareness. Okay, initially, my question would have been, is cancer hereditary? And that has been answered in the lecture.
Yes.
Because I lost my mom to cervical cancer and my elder sisters to liver cancer. So since then, anything cancer or any little, let me say I've been traumatized. So any little thing change, I don't play with it. So sometimes they go like 2 years, I was having constant pain in though I've done mammogram, I always do cancer cervical every 2 years. Mammogram I've done twice. But the pain, even after the mammogram exam came out, they said there was nothing. I would just felt like a jolt. Something would just pinch me. It will come and go. It was incessant like that. And I spoke out like you advised. And my friend said, no, you are not going to joke with this. So I was referred to FMC, Meta. So when I got there, they said, okay, you have done mammogram, don't do mammogram again, do breast scan, which I did. And the doctor looked at me and said, what are you doing here? I said, I'm feeling, they said, there is nothing, go. And he sent me home. So, but, every now and then the pain come. I have a friend who is a medical practitioner in the estate. I will say, sometimes we say, maybe it's ovulation. I say, I'm not ovulating, I'm on hormone, whatever. And so for someone like me, I've done mammogram, I've done breast scan. Is there any other test to avoid, the unfortunate?
Yes, okay. Thank you for. This means that everybody has been attentive. Thank you for that. I'm really very grateful. They've answered the question for you. Breast MRI. But it need not be anxious. I don't blame you. It's the right thing to do. Like I said, that lady that something kept jolting her. It may just be your hormones. and it will come and go. Please, no hormonal replacement, hormonal therapy replacement. You are not a candidate to be careless. Continue being proactive, all right? So let's do your breast MRI. And if it tells us there is nothing, oh my God, it will fizzle out. All right? Thank you, ma'am.
Thank you, Ma. Thank you. Good morning, everybody. Yeah, my questions, I have 3 questions here. So, number one, could there be a misdiagnosis? I have a friend. Last year, we don't get to, see for a long time. So, one day, one of our friends called me and said, we should pray for this person. I was like, why? He said, she did a mammogram and one of her breasts was taken out. And by the time she came back, they said there was no cancer. I was like, so, and that breast had been taken out. So, it was like a misdiagnosis. So I want to confirm from you now, could there be a misdiagnosis or something?
That is the highest level of mismanagement.
Wow.
If you see something, there is room for second opinion. You have a right to seek second opinion. And it's not just right. They say they see something and bash, they remove the breast. It's unethical. Removing the breast is a big deal. So if you are going to do that, I'm sure it was one ramshackle hospital.
I don't know. I've not seen her. But
Like
yeah,
this.
okay.
Because you have to do the right thing. Removing a woman's breast is a big deal now. So before you remove, you have to be sure. We would have done true cut biopsy. You don't just see a lump and go and remove the breast. They'll take ultrasound guided biopsy. It's not a blind biopsy. Ultrasound guided. Interventional radiologists will go there or they'll be looking at the screen. Take a needle to the core of the lesion that has been seen. And they bring a sample, we'll run histopathology, we'll do immunohistochemistry. If it confirms breast cancer, okay, the next thing to do is to do a staging investigation. What is the extent of this disease? How big is this lesion? Then you will have a treatment plan. It's either you sit with a surgeon, like I said, it's multidisciplinary. We'll sit down, so what is the way forward for this patient? If this lesion is small, we'll give the patient all the treatment options. Oh, there is room for mastectomy, there is room for breast conserving surgery, all right? So what is the plan? Then, depending on the grade of the disease, histological type, then immunohistochemistry type. If it's the one that we know is aggressive, don't fool yourself. This is what you need to do. This. And the patient is to take chemotherapy. So there is always room for checking, redundant, double check, over and over. Second opinion. If a patient comes to me with an isolated elevated tumor marker, I'll say, go to another lab. I want to be doubly sure that this is what it is. So that wasn't good.
So you agree there is actually okay. All right. So the second one is could hormonal imbalances cause cancer? Like the lady asked, she was talking about having breast milk come out after breastfeeding. So could it cause cancer as well?
There can be hormonal imbalance. Check, they do hormone profile. Whatever is lacking there, there's a difference between hormonal imbalance. Nobody is perfect. If it's something that can be managed with medication, that's so good. But if there's something, you cannot say hormonal imbalance will cause cancer. They are two separate things, or they can coexist together. If you do the appropriate imaging or investigations and you have histopathological diagnosis of cancer, oh, that means there's a cancer. It can coexist, it can be separate, and they may not even be together. It's not a definitive diagnosis of cancer.
All right. Yeah, I just when she said that, I think just brought some things to my mind because for a long time I was diagnosed of hyperlactomia even before I got married, and doctors have told me several times I can't have any children, but to the glory of God, I have two now. So and that's why I actually asked because when she said, I was like, is this person checking my question? Because because I still do sometimes, though it has reduced, really reduced, but I feel like okay. I did in fact, it was a lot. It's ate into my finances, when I was still very single, very young, and and yeah, so it's something that was why I just like had to ask if it's something so that maybe you can just. But that's why I'm here anyway to screen as well.
Yes.
So the third question. So sorry, I'm sorry. Yeah. For the vibrating machine, you said how do we get the vibrating, or where can we get the, for those that are limited, I mean, for those of us that are we're not moving a lot. For me, I do exercises a lot. I walk. My free times I do that, but recently I've been having bone problems, so my knees, my joints. So I've been told not to walk so much. So now I'm looking for other ways where I can actually, get active. I'm a very active person on the normal day. I'm not patient at all. And it's not something I really want to do. So I've been told not to walk so much to reduce my. So I'm looking for how I can get that as well to help me, be active and have my muscles working well. I'm sorry, my questions are.
I think we're kind of in the same shoes. I'm always working, I don't have time. So once I get home, I kick off my shoes, I just mount the machine. I think I saw it online. You can check. I got it on Instagram or something, and it came to deliver. Then when I went to UK, I saw it in my friend's house. So they sat down and they put their legs on it. They were in the living room. And I'm like, yeah, so exercise is this thing. I went to one of my girl's office somewhere in Baghdad in a private hospital. She sat down and there was a small vibration machine on that. So she got up for me to use the table. And I just saw something. I put my feet. I said, okay, it makes sense. So I decided to look for. So I looked for it online, the one that at least the family can be on. I think it has some pulleys that you can put your hand and up and down. But if you don't have energy, just stand on it. The thing will move you. There was a time I was having consistent knee pains, and my leg was feeling. I think I traveled. I said, "What is happening?" I was having constant pain. So all I had to do was just be on that machine for like 1 week. I started having a difference. So it's just a vibration machine. Check online. Exercise vibration machines. I'm sure you will see them. They are very simple to use. I can't put a treadmill in my house because I have a very hyperactive toddler. That was what killed Dr. Wesley. He fell on his treadmill and he hit his head. Have you forgotten? Yeah, he was using his treadmill. He had an accident. So I've heard about treadmill accidents. So I've always been very careful. I cannot put a treadmill in my house. But the ball will go on the vibration. Say, "Brrr." I said, stop it. You can climb the vibration machine and we'll do it together. I said, Mommy, let me put my leg. And the thing is not reaching. You just be saying, oh, I said, please stop. So it's safe enough.
Okay, good afternoon, everyone.
Good afternoon.
I want to say thank you to the JTD family for putting this together. My question is all about the size of the breast. As we have some people while growing, one side of the breast is bigger than the other. Does it mean they are prone to have? Okay, all right.
Thank you for that bigger question. God did not create us equal. If you look at the breast, one is bigger than the other. In some people, it's very obvious. In some people, it's not so obvious. Some people, it's so obvious that they have to package and add stuff so that it will look balanced. It doesn't mean it predisposes them to cancer. I pray God will help all of us. Everybody just has to be proactive, know the normal from abnormal. Okay, for somebody whose one breast is really obviously bigger, somebody will say, what is happening in that breast? You say, no, that's how God created me. And I've been doing all my tests. My breast is normal. It doesn't mean that person is ill or sick. Thank you.
Thank you very much. Can we all please give her a resounding round of applause? Thank you.
I really want to thank our oncologist. God bless you, ma'am. I want to add something. Screening is very, very important. You may not feel anything. In my own case, I didn't feel anything on my breast because you had everything there, maybe a lump or something you're feeling or this and that. I didn't feel anything at all. My two breasts were normal. I didn't feel anything, no pain, nothing, no sensitivity, So please, don't say I didn't feel anything, so I won't do any test or I won't do any screening. I just said I should chip that one in. Thank you.
Thank you very, very much. I know that the visioneer always goes on about how if you're over 40, take your annual screening very seriously. Even though this particular session is about breast cancer, you have all these annual medical checkups that cover so many other things. So please, as much as there's some hospitals that have like affordable versions of them, so you can do all sort of screening. So please take your annual screenings very serious. Okay, so we move from the physical to the spiritual. We've learned about how to, I guess, take care of our bodies and what to do to prevent cancers and all that. Now we're going to invite our very own pastor to come and just give a word to, I guess, boost our souls and our spiritual sense. So please welcome Pastor Bolu Oluyomi as he just comes to give us a pastoral word.